the topic that has been given to me is very specific: overcoming depression, therapist versus friend. I think what I understood by the topic is like why you might need to go see a therapist when you do have friends. Okay. So before we go into the topic proper, I had asked the moderators and they told that mental health related topics like depression have not yet been covered. So I'll just give a brief intro about depression and then move on to the actual topic. It's a very short presentation, about 30 minutes, and in between, if you have any questions, you can just type it in the chat box. I'll have a look later. Okay, so I'll start with a quote by J.K. Rowling. Some of you might be able to identify her. She has been very openly speaking about her depression. In fact, a lot of celebrities have come forward in the past few years and have talked about depression. So even though the stigma is reduced a bit, but in some parts of the world, especially in our country and especially in our state, there is still a lot of stigma, and that is actually the major factor that determines how treatment progresses. So going on to the topic, depression, what J.K. Rowling said was depression is the most unpleasant thing I have ever experienced. It is that absence of being able to envisage that you will ever be cheerful again. The absence of hope, that very deadened, which is so very different from feeling sad. Sad hurt, but it's a healthy feeling. It is a necessary thing to feel. Depression is very different. So one of the queries that I had received before the presentation was about sadness and depression. What is the difference between sadness and depression? So that's why I included this quote, hoping that a person who has underwent treatment for depression might be able to explain it better than probably me or any other psychiatrist. And she actually used this feeling and she described it. Some of you have read the book Harry Potter. There's a character called as Dementor, if I remember correctly. So she said that this was her feeling during depression led to this character. And again, she says that it's so difficult to describe depression to someone who's never been there because it's not sadness. I know sadness. Sadness is to cry and to feel. But it's that cold absence of feeling, that really hollowed out feeling. So it's very difficult to describe. But yeah, so I got my work cut out for me. So I'll just go ahead and try to describe what depression is. So I'm sure that most of you have experienced sadness at some point of, some point of time, or maybe during exams, after exams, failing an exam. Or what is more common now is this breakup and probably a feeling of missing out, or FOMO, that is called. Like you see other Facebook and Instagram pages and you feel like you are not quite there, and so many feelings of sadness sadness itself has taken so many forms. So how is it different from a depression? And when do you say somebody is depressed? When do we actually diagnose depression? I'm sure you guys have been using the term depressed or depression, but when do we actually diagnose depression clinically? So these are some of the symptoms of depression, and this is just for a graphical representational purpose and not the actual, I'll come to the actual criteria in the next slide. Like I said, I'm sure all of you might have felt sad, reduced sense of self. So you fail an exam, you feel like you are not going to pass ever, you feel like you're not good enough to pass, you feel you can't concentrate, you can't sleep, you can't eat, even if you eat, you're having digestive problems, you have no interest in activities. When your friends call you to go out, you say that, no, I don't want to go out, I don't feel too well. And suppose you have an exam coming up in the next 6 months and you're sitting to study, you can't study, all these kind of negative thoughts enter into your head. And this might be normal. I say might be because we have another term called as adjustment disorder. And when we have a stressor, like I mentioned, an academic stressor or an interpersonal relationship that has gone bad, all these kind of stressors can actually lead to these symptoms, and we call that an adjustment disorder, which is quite different from depression. So as you can see in the slide, it is written experiencing 5 or more of the following symptoms for 2 weeks indicate a depressive disorder. The actual criteria varies a bit. So this is the actual criteria. At the top, you can see DSM-5 and ICD-10. These are the 2 books that define criteria. Like in physical illnesses, like like suppose you can say you have a fever and you go to the hospital and the doctor diagnoses that you have say a pneumonia. So the doctor has done some tests. He has got some results as positive. He has done a chest X-ray. He has seen signs of pneumonitis or pneumonia, and he tells you that you have a pneumonia. Unlike that, in depression and in almost all the mental health disorders, we don't have investigations to actually prove that you're suffering from a depression or any other mental health, or any other psychiatric illness. So what we do is we have criteria, and two sets of criteria, two sets of books are available for us to diagnose. One is the DSM, Diagnostic Statistical Manual of Mental Disorders, currently in its 5th edition. This is published by the American Psychiatric Association. And the ICD-10, the International Classification of Diseases, the 10th edition, is not actually a book solely for mental health disorders. It includes all the disorders, but it has one section which includes mental health disorders also. So we use these two criteria to actually diagnose a person with depression. The DSM criteria is a bit easier to study, or if you want to really know it, they have given it more clearly. So you have to have these 5 symptoms. Out of 9, you have to have at least 5 for about 2 weeks. And the ICD criteria is also similar. So the main two criteria are the depressed mood and the decreased interest or the diminished interest or pleasure in almost all activities. So these two are the main criteria according to DSM-5. While in ICD-10, the main 3 criteria are again the depressed mood, diminished interest, which we also call as anhedonia, and another criteria known as reduced energy. And again, the rest of the criteria is also similar. I just read the DSM criteria. You have a significant unintentional weight loss, or it might be weight gain, insomnia mostly, or sleeping too much, agitation or psychomotor retardation. So you can see it can be both extremes, but mostly it is all less, like sleep is less, your activity is less, you lose weight, your appetite is less, you don't have much energy, you are unable to concentrate, or you have a diminished ability to think, indecisiveness, negative feelings of worthlessness, hopelessness, helplessness, guilt, and recurrent thoughts of death, especially when it is severe. So according to these criteria, we diagnose. So it is not according to the severity of this criteria. If we have these five of these symptoms, if you have any of your friends, suffering from 5 of these symptoms or even less, I would suggest that you immediately ask them to seek help. I come to all that later, but this is how we diagnose depression. This is because there's a lot of subjective variance even among psychiatrists. Like one psychiatrist may say it is depression, another psychiatrist may say it is an adjustment disorder. So to make it all a whole single criteria, that is why we have these 2 books. Okay, so what actually causes depression? This is a very important question that is being asked by a lot of patients and even others. Even when I hold webinars, everybody asks me what causes depression. There is no exact cause. I'd say it is multifactorial. Risk factors and causes are multifactorial. Mainly, it includes genetics. There's a brain chemistry imbalance, physical health issues, drugs or other substances like alcohol, and stress. So on the whole, we can say there is a biological cause, psychological cause, and a social cause. So this is important when we come to the treatment also, because we follow a biopsychosocial model in the treatment also. And biological causes mainly include, like I already mentioned, genetics, your physical health, if you have any metabolic disorders, if you have any neurological conditions. All these contribute to the biological factors. Psychological factors include your personality, your temperament, your coping skills, your social skills, your self-esteem, your attitude. Again, there's a lot of overlap between the biopsychosocial factors and interpersonal relationships, grief, trauma, all that can be included under social factors and also psychological factors. Social factors, like most of you all might be having a peer group, school, work, socioeconomic status, family circumstances, all these can actually cause depression. So I included this slide because there was a query about the genetics, like if somebody in my family has depression, do I have a higher risk of getting it? Yes, you do have a higher risk of getting it. as it is mentioned in this slide, if someone has a parent or a sibling with major depression, that person probably has a 2 or 3 times greater risk of developing depression. And heritability is about 40 to 50%. This might sound a bit high compared to other physical disorders, but it's actually quite low when compared to other mental health disorders. Like, for example, bipolar disorder, schizophrenia, and all have a higher heritability. The specific genes have also been identified. I'm not going into the details of the genes. It is a serotonin transporter gene that is mainly studied, and I will tell you in the next slide. Yeah. There are 3 neurotransmitters or 3 chemicals that are actually involved in depression, and almost all mental health disorders or psychiatric disorders involve these 3 neurotransmitters. And I'm not going into what are actually neurotransmitters, but let's just say that there's some chemicals in the brain and they contribute to all these, as you can see in the slide, noradrenaline, noradrenaline, they can contribute to your energy level, your alertness, concentration, and serotonin mainly contributes to your memory, obsession, compulsion, and dopamine is actually involved in the reward circuit. Even when you have some good food, you have your dopamine circuit or reward circuit is activated and you feel good. And there's an overlap between all these things that contributes to your cognition, emotion, and mood. And basically in depression, all these 3, noradrenaline, serotonin, noradrenaline and serotonin mainly are decreased. And dopamine in some areas of the brain, it is decreased. While in other areas, it might increase when it is severe. But basically, you have to remember that all 3 are decreased in depression. Yeah, so another question I get asked very often is if it is genetic, if it is a physical or something that has a physical cause, how does it happen after a stress or a stressful event or something like that actually contributes to depression? Even now, most of the patients that come to me, they or their family say that they are trying to identify factors about what actually led to the depression. Like somebody died in the family, they have so and so stress, that actually contributes to depression. Yes, there might be a stressor, but even without a stressor, depression can occur. So when a stressor is there, that the pathway that I have shown on the left-hand side is actually the pathway that is normally activated for stress. Like suppose you have an exam coming up, and okay, let's forget about exam. Suppose you have a sort of a sudden stressor, like suppose you're scared of dogs and suddenly you have to, a dog is in front of you. Your sympathetic nervous system gets activated and it leads to a fight or flight response. And there are a lot of hormones that get activated, and these things, when they persist for a long time, actually might lead to other changes like increase in pro-inflammatory cytokines, like the ones that increase in when you have a fever. And this, when along with a genetic diagnosis, like you have a problem with your serotonin, noradrenaline, all the neurotransmitters that I mentioned, this plus that actually leads to a series of changes that might actually lead you to have depression. So it's both of these. So suppose a person who has a genetic diagnosis actually has a stress-free life, and we all know how impossible that is, that a person goes through life completely stress-free. So if he or she does not have stress at all, they might pass through life without having a depressive episode. But when you have a stressful event, there is always a likelihood of having a depression. So that gives rise to another question, that if I have had a depressive episode in the past, and I have taken treatment for it, is it fully gone? Am I treated? Am I cured? Yes, you're cured, but when you have a genetic diagnosis, like with all other genetic disorders, when you have another stressful event, there's always the likelihood that your depression might come back. Okay, so I know I have jumped a lot of things about depression. There are depression is a very large topic, and even the subheadings of depression require separate classes or workshops. So I'm not going to cover it all. I'll just get to my topic fast. And as part of the topic, what is implicated is that depression, who is ideal to treat it, whether therapy and friends, how does it differ? So before going on to all that, let me tell you about the treatment of depression. There are 3 types of treatment for depression, mainly psychotherapy, medication, and brain stimulation methods. The last one, the mind-body medicine, as you can see, can boost the last line mentions that it can boost the effect of therapy or medication, but like it's like yoga, relaxation exercise and all, they cannot actually cure depression. But along with psychotherapy and other medication or even brain stimulation methods, they can work. So the mainstay of treatment is medication. I'm not going to the details and all, but basically what I have already said, the decrease in serotonin is, if you want to remember one thing about the cause of depression, just remember that decrease in serotonin causes depression. So what we do by treating it, or the drugs that we do is, that we provide is, as you can see, there is serotonin in the synaptic junction, and in the synapse the serotonin is decreased. So what we do is we actually prevent the reuptake of serotonin, and this causes serotonin to increase. I think I have to go into a few more details to actually explain this, so I'm not going to go into this at all. Just remember that the treatment works by increasing the serotonin level. There are other sorts of, there are many drugs, there are so many drugs. The number of drugs have increased not because the drugs don't work, but because some of the drugs have some certain side effects. So you want to avoid that side effect. That means we can try another group of drugs. So like that, most of the drugs have a good response rate, and even remission rates are quite good. So most of my patients, including people, doctors and all who know about it, they come to me saying that they want counseling or psychotherapy. That is why I have highlighted that psychotherapy is not for everyone. Suppose you are having a moderate or severe depression, we cannot go ahead with psychotherapy. We can, but along with medication only. So medication or the medicine are the mainstay of treatment of depression. I say that again and again because a lot of people are very scared about taking medicines. And in fact, the medicines don't have much side effects at all. So psychotherapy, there are many forms of psychotherapy: cognitive behavioral therapy, interpersonal therapy, supportive psychotherapy, behavioral therapy, marital therapy, family therapy, and all are different categories. But anyway, the first two, cognitive behavioral therapy and interpersonal therapy, are the ones that are indicated in mild to moderate depression. And the last thing I mentioned was brain stimulation methods. As you can see, there are various brain stimulation methods like vagus nerve stimulation, repetitive transcranial magnetic stimulation, that is RTMS, or deep brain stimulation. These are, by this what we do is we actually stimulate certain areas of the brain to release certain chemicals and bring about certain changes which actually lead to the depression getting better. And the last one that I have shown in the picture is one that has a lot of misconceptions among the general public, among you guys. Some of you might have seen this film, some of you might have seen the Malayalam version of the film, Kalavattam, and they have all shown that ECT or electroconvulsive therapy is something to be scared of. It is nothing like what is shown in this picture. It is in fact one of the safest treatments, one of the most effective treatments. But there is a lot of stigma, not only in our country, all across the world. There is a lot of stigma because in the past, ECT or electroconvulsive therapy had been used in a lot of, I would say, bad ways, and it had been used sort of as a punishment, as is shown in the film. And there is a lot of films and media going on about all this, how ECT was used, and because of all this, we see a lot of patients refusing this treatment even when it is indicated. I would like to say that it is very, very safe. You can ask any psychiatrist, you can ask any person who is involved in mental health. They would tell you it is one of the safest procedures. It is done under anesthesia. It takes about maybe about half an hour. And what we do is actually we induce seizures or fits or convulsions, and that for about 20 to 30 seconds. And that does not mean that your whole body vibrates. We do it under anesthesia. And so only a part of your body which is isolated vibrates, and that's it. And you come out like you come out of any maybe a small surgery, and you are able to resume your activities by the end of the day. If you come in the morning, by afternoon or evening, you can actually go home. So it is that safe. Okay, so that is about the treatment, and now let me get into my topic. So who can help me? First of all, what is the difference between psychiatrist and psychologist? That is also often asked. And psychiatry, I am a psychiatrist, I am a doctor, I have completed my MBBS and my MD. Whereas psychologists, they have done an advanced degree in psychology, and there's a difference because we actually assess the psychiatric, not only the psychiatric aspect, also the physical aspect, like some metabolic disorders, some neurological problems, like for example, hypothyroidism, which is commonly seen in females as a cause of depression among them. So, and if you go to a psychologist and you continue therapy or counseling, and you see that it is not making any difference, you should always consider that there could be an underlying cause. Unless the hypothyroidism is treated, we might not be able to treat your depression. So, I would always suggest consult with the psychiatrist first and let him or her decide whether you need therapy or you do need medication, or at least undergo an initial evaluation by a psychiatrist, and then once you're sure that only therapy is indicated, you can consult with a psychologist. Even I refer a lot of cases to psychologists because often we don't have the time to do psychotherapy in all the cases. So that is the difference between psychiatrists and psychologists. And also, again, what is the difference between counseling and therapy? So counseling is a very short-term process. Actually, counseling, the word meaning, and you might have attended a lot of counseling already, not because you have a psychiatric illness or a problem, but even when, I don't know what is going on right now, but during my time and after an entrance exam, we had counseling to allot our seats. Like I got into so medical college. That was also called as counseling. So in counseling, what is done is basically you are provided options, what you can do with your life. There's a school counselor who provides options that what you can do with your future. So that is basically what is counseling. Like you have a problem in front of you. So it is a short-term process that focuses on that problem, and it does not go into the past. It does not ask about your childhood. It does not ask about, like you can see in the cartoon. It does not tell me about your mother. It's very short-term, and you have a problem. You try to solve that problem with the help of a counselor. Whereas therapy or psychotherapy is a more long-term process. In fact, it can take up to 1 year, 9 months to 1 year. Usually about 3 months is enough, but it can take up to 9 months or 1 year in case of some personality problems and all. And we go in a lot of depth and look for recurring patterns, emotions, and all these things. And often during therapy, you have a lot of outbursts. You might get worse in the beginning and then only get better. So that is why we say psychotherapy is not for everyone, because there might be, if depression is severe, we cannot sit and do psychotherapy. If the person is suicidal, we cannot completely do psychotherapy. You have to bring the person out of it, and then only we can actually maybe conduct therapy. You have to be psychologically minded, or you have to be ready for therapy to actually do it. So that's why I say it's not for everyone. So just coming to the topic, friend versus therapist, that is the topic that is given to me. So I'll come to all of this in detail. So many of us, we have this, in fact, especially guys, I have seen a lot of males, they are more than satisfied talking to their friends, and they think that is enough. So why is that not enough? Why do we actually need to maybe see a therapist? Therapists are trained professionals. They are objective. The data is confidential. Therapy focuses on you, and it comes with clear boundaries. These are the main distinguishing factors. So we'll come to each of them in detail. So what do I mean by a trained professional? So suppose your friend, you are telling your friend that I'm feeling bad about this girl broke up with me and I'm not feeling good. And most often, the friend will either take it lightly. They might tell you, let her go, another one will come your way. You are an idiot to be wasting so much time behind a girl. You should not worry. You should not be moving around. All these things, their intention is good. They're trying to help you. They're trying to realize it. They're trying to minimize it, and they're trying to help you come out of it. But often that is not indicated. That is, in fact, in depression, that can actually be dangerous. So that is why I say it is first important to identify whether the person is actually suffering from depression. These kind of advices may actually work if the person is not depressed. If the person is just sad, this kind of advice might work. But in depression, just talking might not be enough. That is why you need a trained professional. So even though psychotherapy in many parts of the world it is called as talk therapy, that is just our way of actually removing the stigma. But it is not just talking. That needs to be very clear. It is not just talking. We are trained to actually probe you. You might not even realize that we are probing you. You might not even realize that we are actually gathering this information from you. But that happens during the course of therapy without even you knowing it. That is why you need a highly trained professional. And again, your friend or whoever you are approaching, maybe your family, somebody in your family, absolutely cannot be objective, cannot be unbiased because he or she has known you for a long time. And they cannot actually tell you something, they cannot tell you, they are very scared about hurting you. They only want you to get better, they might only have your best interest in mind, and so they can actually, that might not be helpful. You might actually need to hear some things that you don't want to hear, and that your friends might actually be scared of telling you. So for that, for therapy to work, you need to be the person who is offering therapy needs to be objective. In fact, if somebody in my family comes to me and seeks psychotherapy, I would without a doubt refer them because I cannot actually remain unbiased or neutral with a family member. I know most of the people argue and say that you are more comfortable with friends, but if you want to get better from depression or from any psychiatric disorder for that matter, you actually need to visit a therapist. So another thing is, I mentioned privacy. You cannot actually trust friends to keep all your information private. They might end up sharing some of the things. Even that might actually be with your best interest in mind or not. You have, I know a lot of girls, especially adolescent girls, they share information with their best friend, but their best friend might be somebody else's best friend, and that goes on, and soon the whole college or the school knows about it, and that actually has unfortunately led to a lot of sad events like even suicide. So you can actually, we are legally bound to keep your data confidential and private, with certain exceptions, but otherwise, whatever you tell us, whatever thought, whatever violent or whatever sexual or whatever thoughts you have, whatever you share with us, it will be confidential. And like I said, therapy focuses on you. When you start sharing with friends, it becomes their problems. They start telling that I have suffered from so and so similar problems, and it branches out. I know so and so person who has also suffered from so and so problem, and it branches out. So to prevent that, we as therapists we limit the amount of self-disclosure. And even if I have undergone a depressive episode, I'm not going to be talking about my depressive episode. In fact, that can be harmful in certain cases. And we have clear boundaries. Often what happens is when especially between the friends of the opposite sex, you don't have boundaries, and when you start sharing, it often leads to a relationship that might not actually be healthy for you, because when you are depressed, the decisions that you take might be impaired by your depression, and often you end up going into relationships that you might not have gone into if you are not depressed. So that is why it is important to have boundaries. And as friends also, we need to set boundaries when we are dealing with our other friends who might be depressed. And a lot of people are worried about taking up their friends' time. I don't want to bother them with my problems. They are otherwise also deceived, and why should I bother them with my problems? This does not happen with therapists. We are paid in full. I know some people think that therapy is expensive, but if you compare to most of the countries outside India and all, it's very, very, very expensive compared to what you have to pay for therapy in India. And sessions are often charged according to the time that you take. So you don't have to worry about taking up our time also. And in therapy, often you need to have conflicts with the therapist. I have had patients actually shouting at me, saying that they're never going to come back. And this happens quite often because we need to know what all sort of conflicts are there within you. And apart from conflict, there is also the issue of there might be also love and hatred also. This is called as transference. That is the emotions that are transferred onto the therapist by the patient. And this is often necessary this is often part of the therapy process. And you can't do that with a friend. If you, the friend might take it personally when you start shouting, and that might be the end of your friendship. Okay, so that is some of the advantages. There are many other advantages, but I know the time is running short, and I'm coming to the end of my presentation. So, what can actually friends do? Friends, I'm not saying friends are not helpful. In fact, in most of the, when I take stress management classes and all, my first solution is talk to your friends, talk to your family, discuss your problems, because friends are always the first line of defense that you have against these stressors. So they can help you. They definitely can help you before you go into a depression. They can actually prevent a depressive episode. But once you're in depression, I would say that there are certain do's and don'ts that your friends have to follow. Suppose you or your friend is suffering from depression. First, listen to them. If you listen to them, then only you can move on to the second thing. That the left side is do's and the right side is don'ts. So you have to identify the problem. I have mentioned the symptoms of depression. So identify depression and help them to find help them, guide them in the right direction. Point them to a psychiatrist, point them to a psychologist, and support them as they are navigating to therapy, through medication and all. Support them. Like I said, it is very important to have boundaries. When your friend, especially when they are depressed, and they might say some things that you don't actually agree with or don't like. And again, I have seen a lot of, especially girls, because they are more sharing. They share their emotions much more. They share with their friends, and their friends also end up getting depressed. So it is very important to care for yourself, not only the person who is depressed. Learn about depression, know the symptoms of depression, so that you know that whatever the person is saying to you is because of the depression and not because they actually hate you or they might be angry with you or something like that. Be patient with these friends who might be suffering from depression. They will get through it. It is not an incurable disease. Stay in touch with them. Always inquire about them. Just don't point them in the direction and then leave them. Let them finish therapy and then I get in touch with them. Not like that. Stay in touch with them. The don'ts are, don't take things personally. Don't try to fix it or the depression or whatever you feel that they're suffering from. Don't try to fix it if you feel that you can't. And don't give sort of advices or you think it might help, but it might actually not help. Basically, what happens in depression is whatever we say, we might be saying it with a positive intent, but the person who's depressed, they will be receiving it negatively. You might be saying something positive, but that might not be the way they are seeing it. They have all these negative sort of thoughts in their head, and it's like the moderator already used the word overcrowding. That is overcrowding their brain. And in between, you say something that is trying to make it positive, but they can't see it. They will again add that as a negative thought, and that will overburden them. Don't minimize their problems, as I already mentioned. Don't compare with your own or others' problems. And don't deny treatment. I have seen a lot of friends saying that don't take medicines, don't visit a psychiatrist, don't visit a psychologist. Everybody will make fun of you. You will be called crazy. Don't tell like that. Again, don't take advantage of the situation. And I have already mentioned this. Don't scold them. Don't tell them like, come out of your depression and just snap out of it. What the hell are you doing? How are you staying in depression for so long over a girl or just an exam paper? I have also failed this paper. Why? Don't scold like that. And don't exclude them from other activities. Just because you feel that they're depressed and they will bring the mood down, don't send them invitations. Don't if they say no, okay, fine, but don't stop. Don't exclude them, and don't over pamper them also. Just because they're suffering from depression, you don't have to do all their work for them. Because once you start pampering them, they might not want to even actually come out of their depression. So a lot of do's and don'ts. This is not an exclusive list, but I hope I have given some idea about the topic. I know I went through a bit fast. I'll come to the queries. I thought we can have a discussion later. So this is my thank you slide, but I have put a candle over there because the World Mental Health Day 2019, okay, that was celebrated on October 10th. And unfortunately, since then we have it's been a very traumatic time. 2020 has been a very traumatic year, and the number of suicides have gone up. You might have heard in the news. I think today also in the news there is something about the suicide. There is a doctor suicide. So a lot of suicides are happening now. What I want to say is the team was working together to prevent suicide. 40 seconds of action. 40 seconds you need to listen to somebody. You might actually prevent someone from committing suicide. That is because World Health Organization states that one death due to suicide every 40 seconds. So you can see how much more harmful it is than this coronavirus and COVID-19. The death rate is much more higher than any virus. So if you can, and it is the second leading cause among 15 to 29-year-olds. So it is very important that you guys know about this. And if you have any friends, if you have anybody you know suffering from anything close to depression, or even if you might think they are saying it for fun, but usually people don't say it for fun. So if they say something like about suicide and all, it is best that you refer them to if your college has a counselor, a college counselor, or a psychiatrist or a psychologist, or at least get in touch with their family and ask them and tell them that your friend might be feeling this way. So on that note, I will end with another quote that wisdom comes to us when it can no longer do any good. This is Love in the Time of Cholera by Gabriel Garcia Marquez, and I hope this wisdom has not come too late. And I hope with this, at least some of you might be able to pick up on depression and help a person who actually needs it. So yeah, once again, my thank you slide. I hope some of you might be able to identify this picture, the diary, where it has been there in a recent movie. People expect you, the worst part about having a mental illness is people expect you to behave as if you don't. So there is nothing like that. The stigma of mental health is decreasing day by day. And I have people from all, I would say all category of people seeking for help, and it is very much okay to ask for help. So yeah, that is my presentation. I hope we have time for a discussion, and I hope this presentation helps. Thank you. So I have stopped sharing my screen. If necessary, I'll share it again. But let me just have a look at the chat section if there are any queries. Actually, there were two more queries that I did not answer. I'll get to that first. Two more queries had been sent across to me. One was about the connection. Actually, I'll get to the first one, that is about this time during this quarantine and lockdown, the stress has been increasing. What can we do about it? Okay. So what I say is, to manage stress, the best way is to stick to your routine. That has become very hard in this quarantine or lockdown time and all. It has become very hard to stick to your routine. Some of you might have been going for jobs, you're not able to go for jobs. You have been going to college, you're not able to go to college. You have been going out with friends, you're not able to go out anymore. And all this has affected our routine. You wake up in the morning and you don't know what to do. You're sitting simply, and when you're sitting simply, all these kind of negative thoughts start. There's an old saying that idle mind is a devil's workshop. So all these kind of negative thoughts come into our head. So I would ask you to mainly stick to your routine, and in your routine, do include time for some sort of relaxation, some sort of play, some sort of exercise, and all that, and spend some time with your friends. I know all of you have a lot of friends on Facebook and Instagram. I don't mean that. I don't mean liking each other's posts and all. I do mean actually conversing with them, maybe over a video call, or if possible in person. So that is one of the ways to decrease stress during this lockdown. But yeah, I agree that this is a new kind of stress, novel stress that even I also don't know how it is going to end. So till it ends, I hope all the people who are currently suffering from this stress and all stick to their routines, exercise, and even if needed, consult with somebody. If you feel like you're not able to handle it on your own, please do consult with somebody. In fact, that is my take-home message. Do see a therapist. Do see a therapist. Therapists actually include psychologists, psychiatrists, counselors, social worker. Everybody is included under therapist. But do see someone. Let them take a call, and that is one of the ways to handle. So, and the second question, I actually did not understand the question. That is the reason that I did not take up that question. I hope that I'll just let me look at the question. It has been sent across to me. So yeah, the question was, how does mind-body connection affect our emotions? I did not actually understand the question. It's a good question, but the question has been framed a bit wrong. So mind and body and emotions, all three are interlinked. So suppose you have to give a presentation. Suppose I'm going to give this presentation and I'm feeling tense. You describe butterflies in your stomach. So that is actually a physical expression or how the body reacts to the stress in your mind. So what you call as mind, we say that it resides in the front part of the brain or the prefrontal cortex. So that actually gives rise to certain, it stimulates certain other regions of your brain and causes other parts of your body to be involved. I showed you the stress pathway already, how stress can actually give rise to certain hormones and certain chemicals, and then it can cause bodily changes. So I hope that answers that question, or if not, you can ask me again in the chat section. So there are a lot of questions. I start with the first one. When a friend approaches us totally broken down with her issues, are we first supposed to give her emotional and mental support or try solving the problem she is facing? Please don't do the second thing. Don't try to solve the problem she is facing, because often it can have a negative effect. So suppose, I think I already mentioned this. If a friend approaches you with her with her issues, listen to her. You feel that you feel that she's going to get through it with some support. You can support her. But if you feel that it is getting worse, I mean, first day you talk about it and she's feeling bad. Second day you talk about it, she is feeling very bad. Then that means she's getting worse. So then you can actually suggest seeing somebody else, seeing a professional. But if you feel like she's getting better, if you feel like the suggestions, often what we see is the people who are approached. Suppose one friend approaches another friend for solutions, and often I find that depression and these kind of anxiety problems are very much common in the people who actually offer these solutions, because they use that as a defense mechanism too, so that they don't have to deal with their own problems. And I have seen that especially among girls, a lot of girls come to me saying that they're very good at solving others' problems, but
Hello. Hello. Hello.
Hello, sir.
Hello, Sri. Sir, we're not able to hear you, sir.
Is there any problem? No. I'm not able to hear. No. Is there any problem?
No, I guess
Discussion. Is it all right? The talk is going on, or
I think his connection is lost.
is there an interruption? Is there an interruption in the talk? Because I have some. I felt that there is some interruption. No, because I'm not able to hear what is taking place there.
I think it's
Sir, we'll
Continue.
just call him and check, sir.
Pardon?
Sir, we'll just call Srinivasan, sir, and check with him.
Yeah, yeah. Because I think there is some interruption.
hello.
Yeah, yeah. Yes.
Hello, sir. We can hear you, sir.
Yeah.
Yeah. Sorry, my connection. I just got a bad connection. I think the chat. I'm not able to view the chat right now.
Sir, if you I'll read the questions for you, sir.
Yeah, I think that will be better. I can't see the chat now.
All right, sir. Shall I move on to the next question?
Yeah.
Okay. What is the most promising recent development to treat depression?
Yeah, actually, that was another question that was there and that was posted to me. Actually, the treatments, I described three types of treatment. All three are advancing. So, in medicine, we have a lot of new medicines. Most of the medicine that I mentioned, that I showed you, take about 1 or 2 weeks to actually begin their action, and you have to take them for a long time. So, there are some newer medicines like ketamine, and there are some newer medications coming across that act a bit more faster, and you can actually, they are even available as some sprays, and also there is a lot of development going on in the medication field about the psychotherapy part, I mentioned cognitive behavioral therapy, and these kind of therapies are also, I mean, they're going on to a different level. Like there are online CBTs, you can download apps that actually offer CBT. So AI and all are changing the field in psychotherapy and all. I don't know how much effective it is. There are some studies saying that they are effective, and there is no difference between in-person psychotherapy and an online CBT. But in my experience, I have found I did start online treatment, but I found that it is not as effective as when you meet with the person, meet face to face with the person. So that is another development that has taken place in the field of psychotherapy. And there are also advances taking place in brain stimulation methods. They are becoming less and more, the stigma is decreasing, and the treatment methods are becoming more and more useful. So I would say that in all the fields, there are a lot of advancements going on.
All right, sir. Thank you. Why do depression mainly affect the youngsters nowadays than old age groups?
Okay, so actually there was a slide in this presentation that I had hidden. I just hid it before actually presenting. The main age group that is affected is, there are two peaks. One is during the adolescent period and another is in later life. The causes for both are different. During the adolescent period, we are actually, before 16 or 17 years and all, we are actually, our personality is actually developing. And after that, we are adapting to the world with our personality. So that is the time we form an identity of our own, and at this time, if we have not been adequately trained, or we don't have adequate coping skills, and our resilience is not too high, or self-esteem is low and all, there is a high chance that we might go into depression. In fact, that is one of the reasons that depression is becoming so common, and suicide is also becoming so common among this age group, because the children are brought up in ways, they are often very pampered, they don't have to face much stresses, and suddenly when they go out to college and start to deal with their own, they're not able to handle it. Also, because the genetic factors also are increasing, a lot of people suffering from depression, and then their relatives also suffer from depression, and because there's something called a genetic anticipation, and that also contributes to an increase in depression.
All right, sir. Thank you. How to deal with homesickness and associated depression?
Okay, actually homesickness is different and depression is different, but homesickness can lead to, I mentioned something called as an adjustment disorder. So often I find a lot of students who come to me saying that they have gone to, like right now I'm in Kannur. From Kannur they have gone to Trivandrum, and they are not able to stay over there. They don't have any friends. The people over there are very different from the people over here. They're not able to adjust properly. And because of this, they are suffering from all the symptoms of depression that I already mentioned. They're not able to see, they're not able to eat, they're not able to concentrate on their studies. They have been studying well till 11th, 12th and all. They had been the topper, but after going to college, they are not able to study anything. Their marks are decreased, they're failing exams and all this. Usually, when this leads to a depression, the treatment remains the same. But then, like you asked, in homesickness, if you're feeling, what you can do is you have to start going out, making new friends, because to adapt to or to acclimatize to a particular environment, you need to start getting involved in the activities that are being held over there. You might find another person who's suffering from this similar problem. So that is one of the cases where actually friends can help rather more than therapists. When you are suffering from homesickness or something like that, friends can actually help more than therapists. But if you find that it is getting worse and you're not able to control your depressive thoughts and all, go see a therapist. Okay, thank you.
All right, sir. Can we listen to beta, alpha, and gamma brainwave without asking a doctor?
Actually, I'm able to see that question. There were a lot of questions in between that. All that is filtered, huh?
No, sir. Now I'm going from the back so that I don't miss anything.
Okay. So, I didn't understand that question. Can we listen to beta, alpha, and gamma brainwave without asking a doctor? Are you referring to the beta, alpha, and gamma waves that are shown on an EEG? And I don't know why you want to actually listen to that. Okay. I think she has replied yes. Yeah. So why do you want to actually listen to the beta, alpha, and gamma waves? And I don't understand how it is relevant in this topic and depression, because there are changes in the beta, alpha, and gamma waves. So I did not mention any in this presentation. You want to diagnose according to an EEG, is that it? Are you asking that can I take an EEG and diagnose my depression by myself? If that is your question, then no, definitely no. An EEG is not diagnostic of a depressive episode. And to diagnose a depression, in fact, I have met a lot of doctors and all who are self-diagnosing depression, and I would suggest please don't do that, because even if you diagnose for treatment, it is always better to consult another person. I myself would never, I will never treat myself. And if I ever find myself suffering from depression, I would definitely go to another psychiatrist or another psychologist and get myself treated, because at that stage, whatever I know, whatever I have told about depression, everything, all that goes out of the window, and all these kind of negative thoughts will be clouding my head. So I still did not get the question, but yes, I hope I have answered it.
Okay, sir. How do you suggest tackling clinical depression during old age?
Yeah, old age is actually a different thing. I did not include it because I thought most of the audience will be adolescents. So old age depression might actually be more likely to have a physical cause or a neurological cause. I usually, if a person presents to me in old age and suffering for the first depressive episode at that time, I usually ask them to do a CT scan, do all the investigations, because more often than not, we find an underlying cause for the depression. Like they might be suffering from some actual changes, some MRI or CT changes in their brain that can actually help identify the depression. It's not that I won't start them on treatment, and even if we treat the comorbidities, we do need to actually treat the depression also. So we need medicines for the actual depression and also for the comorbidity or the hypertension, diabetes, or hypothyroidism, or the lacunar infarct, or whatever we think is causing the depression. We do need treatment for that also. And hopefully, yes, and therapy also helps in old age, because in the specific age group when when children are actually leaving parents, when they are having job changes, when they retire, and all these times they are having these phases, they have some sort of problems, or like I mentioned, adjustment disorders and all. And depression is very common during that phase. That is when therapy also will be helpful in these people. So if there's no biological cause, and if it is during this kind of a phase, then definitely yes, therapy also can help with depression. Okay, next.
Okay, sir. What are some of the signs and symptoms of depression? How can you deal with anxiety? I clubbed two questions together.
Okay, but I think the person who asked the first question has joined this chat, the presentation late, because I think I did mention the signs and symptoms of depression already. I have sent the presentation across to your moderator. You might actually take a look at the presentation, and I have mentioned the signs and symptoms. Okay, actually, the anxiety, again, it's an entirely different topic. Like anxiety disorders include a broad, that's a very broad category. It includes generalized anxiety disorder, panic disorder, social anxiety, and even obsessive compulsive disorder, OCD as you might know it, was also included under anxiety disorder. So it's a broad category. I really don't think I can actually mention the symptoms. You might be knowing some of the symptoms of anxiety, like your heartbeat starts increasing, palpitations, breathing difficulties, panic attack. These all might contribute to a panic attack. You feel like numbness, you feel a tightness in your chest, you feel paresthesia, or tingling sensation in your arms and legs. You feel like you're going to faint, and all that actually contributes to a panic attack. And these might be symptoms of anxiety. You might have muscle aches. You might find yourself worrying unnecessarily about things like something is going to happen to your father, mother, something in the future might go wrong. All these are symptoms of anxiety. And like I said, I cannot answer that question very clearly. I know I have not answered it fully, but it's a very huge topic. It's entirely different from depression, but it can occur along with depression. Okay. Next.
Okay, sir. Are there any specific symptoms that a child would show if he or she is going through depression?
Yes, that's actually a very good question. In children and in old age, I mentioned when I talked about the signs of depression that usually the sleep is less. In children, the sleep might be more, also in old age. I mentioned the appetite is usually less. In children and in, even in adolescents and old age, the appetite might be more. So in extremes of age, you might note the reversal of symptoms. So instead of being actually depressed, they might actually show irritability. They might actually act out. They might actually start getting more angry. They might actually, and that also that is actually very kind of difficult to identify. In children, we usually don't even make a diagnosis during the first time because there might be a lot of diagnosis to consider. Often the parents come and tell that the child is not studying anything, he's just fighting and he's getting very angry and all, and when we go deep into it, that might actually be an underlying depression. So it is not, the signs and symptoms are not exactly like what I mentioned, but you might find a lot of similarities also. Okay.
Okay, sir. Some people suffer from depression for years. Are they more prone to other mental or health disorders?
Yes, depression, along with depression, because most of the neurotransmitters that are involved are similar, and the genetic environment itself might actually contribute to other mental health disorders. If you find yourself suffering from recurrent depressive episodes, yes, you can have other mental health related problems. Like I mentioned, anxiety, obsessive compulsive disorder, substance use problems, and all are very common along with depression. In fact, I did not mention substance use problems. That is often what is used to tackle stress and tension in our state. So, if you please don't do that. That actually increases your depression. If your friend is depressed, don't ask them to come on, let's go out and have a drink, and all your depression will go out. I actually did not mention that. Sorry. So don't do that because drinking and use of substances might actually increase your depression. As it might get you out of it for a while, but I think you all might be knowing better than me that the depression or the tension comes back as soon as it wears off, and then you have to take a drink or puff or something like that, and then it goes into an addiction or a cycle. So don't do that. Okay. Next.
Okay, sir. Is depression more prevalent in women than in men?
Yes, it is more prevalent. It is about 2 to 4 times more prevalent in women than men. I'm not going into the causes, but it is more prevalent.
They've asked why.
Okay, they have asked. Okay. Because women have a lot of other hormonal changes that happen, especially during the menstrual cycle and all. When they get their menses and all, they have a lot of hormone changes. Then the hormones go back to what is considered normal, and then again they have a hormonal change. And during this period, they have mood changes. They have to go through pregnancy. Again, a lot of hormonal changes. That is also a period of vulnerability when they can suffer from depression. A lot of physical disorders that actually cause depression is also more common among women, like I mentioned, hypothyroidism. And women actually, psychologically speaking, women actually have a difficult time dealing with certain emotions, and they are actually more open to sharing stuff and all, and that is why they might end up suffering from depression. Okay, next.
Okay, sir. How do we as youngsters increase our parents' sensitivity regarding depression?
Okay, that is a very good and a tough question. I would actually request all of you, if you all find out how to actually do that, please do let me know also, because I am still struggling on increasing the sensitivity of parents, because I know your generation is a bit more sensitive to depression, but parents, I have had parents, even though I sit about 1 or 2 hours with them and explain to them the exact process, I take a class for them and all, but even then they end up telling that this is all, that he or she is just faking it, she's just weak, she's not able to handle it. I had much more problems in my childhood and I was able to handle it, but she's not having it. I pampered him or her too much, and that is why he or she is having this problem. And all that parents say all these insensitive remarks, and in fact that is one of the reasons that a lot of people from your age group end up committing suicide also. That often triggers a suicide attempt and all. So it is very difficult. You can actually use celebrities, you can who are suffering from depression, you can give them a lot of information is available on the net, so you can give it to them and show them that this is an actual disease or a disorder that needs treatment. Other than that, I don't have a very sure solution that might actually work. If one of you who have parents who want to consult a therapist and your parents are not allowing it and worried about it, I would suggest that you actually see a therapist and have them maybe call your parents and talk to your parents. It would be better than you actually telling them, because more often than not, it does not work. Okay, next.
All right, sir. Can depression be linked to cardiovascular disorders? If so, how?
Yes, depression can actually be linked to a lot of cardiovascular disorders. It can give rise to an increase in your blood pressure. It can give rise to coronary artery disease, because stress itself, not even depression, you don't have to actually be depressed. Stress itself can cause all these things. I showed you a pathway that how stress causes a lot of changes in our body. And if those changes keep on occurring, like you are getting an increased adrenaline or adrenaline for a long time, or your cortisol levels are high for a long time, that can actually trigger even cardiovascular changes in your heart and lead to hypertension. And not only cardiovascular problems, even gastrointestinal problems, a lot of neurological problems. A lot of people often come with headache, and they come with palpitations. They see a cardiologist. Even panic attacks are often first seen by cardiologists, and then only we see. So depression, yes, it is linked to cardiovascular disorders. There is a brain chemistry behind it, and I hope I have simplified the question and just told it. There's a lot more happening behind it. I'm not going into the details.
Okay, sir. Lack of sleep cause depression.
It's actually lack of sleep is usually a symptom or a sign of depression rather than lack of sleep causing it. But yes, lack of sleep, if you're having lack of sleep, you do need to identify why you're having lack of sleep. More often than not, it is usually a symptom of depression rather than a cause. But yes, if you have had some stress and you're having lack of sleep, that can lead that stress to cause a depressive episode. So yes and no, because lack of sleep can cause depression, and it can also be a symptom of depression. Okay, next.
Do toys like fidget spinner, slime, Rubik's Cube make any change in depression?
I actually don't have many studies or anything to tell you from, but fidget spinner and Rubik's Cube and all, they're useful as a distraction, and they actually don't have much impact in depression. They might be able to relieve stress, but like I mentioned, stress and depression are completely different. And I would say if the person is depressed or is suffering from depression, I don't think they are going to have much impact. It will just be a way of just dealing with their thoughts, because like I already mentioned, there's a lot of thoughts going on in your head, and this is just a physical manifestation of you trying to fight those thoughts. So it won't make any change in the depression.
Okay, sir. Can depression have a negative effect on the food habits of an individual? If yes, how to regain control over your dietary habits?
Yes, I already mentioned a decrease in appetite also can be seen, and an increase in appetite. Often people in your age group, after breakup and all, especially girls, they start eating a whole family pack of ice cream, or some on the other end, people might have a decreased appetite also. So regain control over your dietary habits is very difficult. Not only your dietary habits, your sleep habits, everything, your routines are all affected, and this is one of the challenges that we have, because we can't do that with medicine. We actually, if I give you so and so medicine and you find that you're still eating too much or eating less and all, we do advise somebody else to look after what you're eating and we refer to a dietitian, provide them with a certain diet, so and so things to eat, at so and so time, and you have to follow that strictly. If you're not able to do that, we even consider admission and treatment, because if you don't have a normal routine, not for any medicines or giving you any injections and all, but just to get you back to your old routine, we do consider admission in some cases. Next.
Okay, sir. So one of the participants have asked, sir, I feel quite low sometimes. Should I see a therapist?
Yes, definitely. Yes, definitely. If you are feeling low sometimes and you are just asking me that if you should see a therapist, I'm always going to say yes because ideally I would need to evaluate you in detail, but unfortunately I won't be able to do that during this time. And if you are feeling low, go see a therapist. That is the message to everyone. Go see a psychiatrist actually. Go see a psychiatrist first, and then decide. Let him or her decide whether you need therapy or whether you need medicines or anything, or whether you have any physical cause that is making you feel low. So yes, please, yeah, as soon as possible, go see a therapist or go see a psychiatrist. Next.
Does exercising make changes in depression?
Oh, definitely, definitely. Exercise is one of the most important ways to get out of depression. Along with, I did not mention that as a treatment because I actually did mention that along with the treatment, but it is an adjunct, or we can add that along with therapy and along with medicine. We can add that, and exercise makes so much of a change. In fact, even without medicines and without therapy, when you do exercises, you do get a bit of relief from depression for a short while, but that does not last. That is why you actually need therapy or medicines, and then along with that, exercise also makes it can increase all these adrenaline, noradrenaline, and can increase your serotonin levels. All that can increase for a short while, and it's a very healthy way to overcome your depression.
Okay, sir. Why is mental illness not taught in school as it is more dangerous than all the other physical illnesses?
There are some activities that are going on, especially in our state. Our government and our administrators are being sensitized, and there are some activities that are going on. In fact, there are some chapters and there are some booklets that have been included that have to be taught. But often what we find is teachers and all people in the school level, they are a bit uncomfortable talking about this, and they often skip those chapters. They often ask the students to look up those chapters as homework, and it's not given much importance. And like I said, that is one of the problems. That is why once you come to college level, or once you reach your adolescence, and that is the time when you don't know how to handle certain stuff. We have a life skills chapter that has to be included, but often these life skills are not taught properly, and you end up not having these skills. Even the WHO or the World Health Organization has told that life skills have to be taught to each and every child, but it is not being taught properly, and that is why you often don't have these skills to get over, or maybe stop you from going into a depression. The answer to that is it is changing very, very, very slowly, and I don't expect a radical change. Nothing is going, because whatever can be changed from our side, and whatever awareness activities, even this included, would count as an awareness activity that I'm hoping that will sensitize some of you. But not only you, like somebody else had already asked me, parents also need to be sensitized about this. And how to handle your mental health it's not going to be covered in one session or thing. It needs repeated sessions, and probably it has to start from a bit younger age group. Okay, next.
Okay, sir. Why is therapy very expensive?
Because it takes time. See, I don't know about how expensive charges vary according to the therapist or the psychiatrist, but I charge according to the time. And when you count like how much I charge for half an hour, my colleagues who are involved in different specialties, like suppose I have a colleague, an ENT or an ophthalmologist, they can see about maybe 10 patients in about half an hour. Whereas I can see about one patient. If the patient is coming for the first time, I see it take about 1 hour even to see the patient. But mostly I charge according to half an hour charges, 30 minutes charges. So because of that, therapy and psychiatric consultations are very, very expensive. But again, like I said, it is very, I have shifted abroad recently, and right now I'm in India, but I came back before the lockdown. But when I went abroad, therapy is very, very expensive. Like the consultation fees over there would amount to about maybe about 6,000, 7,000 in Indian rupees. Whereas Here it's about 500 to 1,000 rupees. So I would say it is still cheaper over here. Make use of that and do see a therapist or a psychiatrist. It's not very expensive compared to the benefits. Or I see a lot of patients going to a cardiologist doing so and so tests. They spend about so many rupees when they can actually just, if they had seen a psychiatrist in the beginning, they would have had to spend considerably less. So I would say, considering all that, it's not very expensive. No?
All right, sir. What could be the possible cause behind a sudden change in mood that's from being excited and happy a minute ago to being extremely sad all of a sudden, and you find no reason whatsoever?
Yeah, that could be a lot of things. Mood swings, as I would use that one word, mood swings can be part of a depression, it can be part of a bipolar disorder, it can be part of a personality problem, it can be a lot of things. But mostly, if you find that it is like a sudden thing, it comes and goes. Suddenly you feel very angry, and then it's gone, and then you're left thinking about why did I get so angry? I should not have done that and all. More likely a personality problem rather than a bipolar disorder or a depression. But yeah, mood swings can be part of a depression also.
All right, sir.
Yeah.
There's one more question. What age group is more prone to depression?
I already mentioned that in the previous question, that there's a bimodal peak. The adolescent age group is also more prone, and also in the later age group, that is after 40 also it is more prone. So it can occur from all age groups, because initially it was believed that an age group of 40 was more prone, and then now it is slowly shifting to a younger age group. Okay.
All right, sir. So one last question. How can you stop going into depression and keep yourself happy? How can you sense that?
Yeah, you can't actually stop yourself from going into depression, because if you knew how to stop, then everybody would be doing that. We always say prevention is better than cure. But yeah, because like I mentioned, it has a genetic cause, it has an added stress or a psychological or a social cause also. And the genetic cause, obviously, you can do nothing to change. If there's a physical cause, maybe yes, if there's a hormonal problem, if you have a thyroid problem, you can treat the thyroid. So yes, that might stop you from going into depression. But the stress, or you can't actually guarantee that you will not have any stress later in your life. But when stress happens, there are some things called as coping skills, resilience. If your self-esteem is high, often these kind of stressful events, like one thing that might seem as a stress to you might not be a stress to somebody else. That is very subjective. So that is related to your personality, related to your temperament. So if you're asking that as a adolescent, or if you're asking that as a student, I would suggest that keep talking to your friends, keep exercising, lead a healthy life, eat a balanced diet, do all these things, and maybe you might be able to handle stress properly. But if you're asking that as a parent, my answer would be entirely different, because you are raising a child, and there are many things that you can actually do to increase their coping skills on how to, and again, I'm not going into the details of that, but make sure that he or she gets enough education or training in mental health. Make sure that you don't over pamper him. Make sure that the child is equipped to deal with certain life stresses, and all that you can do without even without actually visiting a psychiatrist or without seeing a therapist. You can just do that. But again, there is no sure, like I can say that you can do this and you won't be depressed ever in life. There is no answer like that. You can just there are some stress management techniques that I usually go through. Yoga or relaxation exercises, they contribute, they actually help you to lead a better life. Exercise, other exercises like not relaxation exercises, other exercises, meditation, all that can help. So it's a combination of factors. When you have problems, discuss with your friends. So there are many things like that that can actually prevent you from going into depression. But none of these can actually work when you're actually in depression. Okay.
Right, sir. There's one more. Can addiction cause depression?
Yeah, actually that's a very good question, and I did mention that in the biological, psychological, and social factors. Yes, substances, all sort of substances. Alcohol was more popular during my college time, but I think now it's going on to cannabis or weed. And all these substances, even as simple things like cigarette smoking or nicotine dependence, all sorts of substances have been shown to be more associated with depression. But some substances, especially like cannabis and all, have even been associated with psychosis or a more severe sort of psychiatric disorder. So, yeah, addiction. In one word, yes, addiction can cause depression. And like I said, don't use substances as part of your coping mechanism of dealing with depression. It does not cure depression. It in fact increases it. Okay.
All right. There's more coming in, sir. Sometimes I don't feel anything.
Yeah, I don't mind. I actually have the time. I don't know if the
Yes.
question is restricted.
All right, sir. Thank you. Sometimes I don't feel anything. What are the possible reasons?
Okay, that is a very difficult and quite a personal question. I would have to evaluate you in detail. I just can't like, I don't feel anything. It could be a lot of things. I mean, off the top of my head, I can tell about 4 or 5 diagnoses that could explain it. Uh, I would suggest that if you really need to know, you can consult a therapist or just for that answering that question. In fact, that is one of the reasons. If you look in the West and all, like I said, I have migrated outside. Most of the people don't come because they're depressed and all. They just come and meet me because they feel that they find that they're not able to like a philosophical way. They're not able to figure out their life. They don't know what they're doing with all the questions you ask. Like, I don't feel anything. Is there something wrong with me? My friends are like, when I go out, my friends are very happy. I'm not so happy, and or I get a new mobile, I'm not so happy. Is there something wrong with me? And it's these kind of simple questions that the West and all bring people to psychiatrists. But here, unless the person is severely depressed, they don't actually visit a psychiatrist. So I would suggest, yes, for this answer, you do see a psychiatrist. You might be able to figure out your life, and it might help you. Like the person asked in the previous question, how do I prevent myself from going into depression? Visit a therapist. If you feel like somebody in your family has a depression and you feel like you have a high risk for depression, visit a therapist. He or she might be able to identify the factors that might actually cause you to be depressed in the future also. That might also actually help. So yeah, do go see a psychiatrist, and I hope you get the answer for that.
Okay, sir. Are symptoms of the aged people and the children almost the same?
A bit same, but it depends on the cause actually. In old age, like I already mentioned, there are a lot of variation in the symptoms because the cause might be different. In children, usually the cause, there is no identifiable causes like any neurological causes or any. Usually, those sort of disorders start later. But some symptoms are similar, some are different. Like I mentioned, extremes of age group might actually have more sleep than decreased sleep, might have more appetite than decreased appetite, might actually be more agitated rather than agitated in the sense like they don't have to be like violent or anything. I mention agitated because they might just be walking around the room. They might have an increased level of activity rather than decrease in activity, which we usually see. Usually, a person who is decreasing. I think one person actually asked about the signs and symptoms of depression, and I did not answer that question. But I just give you a picture. Like if somebody is depressed, usually they will not be interacting with you. Their talk will decrease. They will usually not be. They will have a depression. They'll be sad. Obviously, depression means they'll be sad. They will not be doing the activities like if he or she usually reads the newspaper, watches TV. They might not be doing that. Their appetite decreases. Their sleep, they might not be able to sleep. They're not able to study or concentrate in their job. These are the symptoms of depression. These are the symptoms that I mentioned. Now, another question that another person asked was, like suppose you fail an exam and you say to my parents, to your parents that you're not feeling well, you're not able to sleep properly, you're not able to concentrate in the studies. Most of the parents, including my parents, they will tell that you just get out of it. because you failed an exam.
Hello, sir. Sir, we're not able to hear you, sir. Hello, Srinivasan, sir.
There is some interruption.
Yes, sir.
Hope he will be back.
Yes, sir. We'll just check with him.
Yeah, hello.
Yes, sir. We can hear you, sir.
Yeah, okay. So, sorry about that. Yeah, so they complain about all that, and then you get taken to a hospital, and you see a lot of doctors. Nobody is able to identify the cause of your headache, and in fact, some people might actually start you on different medicines. And then finally, when you get no relief, they take you to a psychiatrist. So, let this not be the way you deal with your children, or at least in the next generation, they should be able to come forward and tell you. That is why the listening step is very important. Listen to your children's problems, listen to your friends' problems. Don't minimize it, don't trivialize it, and let's hope that in the near future that everybody will be able to come forward with things like depression as easily as they can come forward with physical sort of problems. I'm sorry I deviated from the question actually, but I just wanted to get this message across because I feel like some of you have still not got the idea of what it means to be depressed. I assume that a lot of you might have actually shared the post of Sushant Singh and also the suicide thing about various celebrities and all. So depression is not very obvious. It is very difficult to pick up unless you listen. You might feel like a lot of people are committing suicide, and you might feel like they have it all. They are very good. They are very popular. They are very handsome or beautiful. And why do you need to feel depressed? They are very rich. They have money, everything. It's not like that. Even me, I include myself. I don't know if tomorrow depression hits me. I don't know how I'll be feeling. So it is that kind of a disease. It can happen to anybody, anytime. Just please take it seriously and whatever. I know the stigma is the thing that prevents you from uh, visiting a psychiatrist, but please do visit.
Okay, sir. Can somebody with depression be a workaholic while being unable to gain any pleasure from it?
Uh, yes, because people in depression use work as a coping mechanism. They feel like if they are always working, they don't have to think about their problems. And often, I do see a lot of people like that. They say that they are not very obviously depressed, but they are always working, and usually other like husband who's always working is brought by his wife saying that he does not share anything, does not share any problems, but he's not able to sleep properly and he's always working. And often when we go into that, there might be a depression. So yeah, work can be used as a coping mechanism by people who don't want to deal with their problems or who don't want to think about all those negative thoughts.